There's something happening right now in this exact moment that most people never think about. Your eyes are working. They're processing light, tracking movement, adjusting focus, sending millions of signals per second to your brain. But quietly, invisibly, beneath all of that extraordinary activity, something else might be happening. 2. Something your body has been trying to show you for months, maybe even years, and almost nobody catches it in time. I want to talk to you tonight about your eyes, not in the way you might expect. Not about vision prescriptions or screen fatigue or dry eye syndrome. I want to talk about what your eyes are actually revealing about your blood sugar right now, whether you know it or not. Because here's what most people don't realize. The eyes don't just help you see the world. They are one of the clearest biological windows your body has into what's happening deep inside your vascular and metabolic systems. And when blood sugar starts to climb, when glucose begins disrupting the delicate chemistry of your body, the eyes are often the first place that story starts to unfold. If you're finding this video tonight, there's probably a reason. Maybe you've been feeling off. Maybe something small has changed in how you see, how you feel, how you sleep. Maybe someone in your family has diabetes and you've been quietly wondering whether you're heading in that direction too. Whatever brought you here, I'm glad you stayed, because what I'm going to share with you is real science, grounded in research, and it has the potential to genuinely change the way you understand your body. My name is Dr. William Lee. I'm a physician, scientist, and author. I've spent decades researching the biology of disease, specifically how the body signals distress long before a diagnosis is made, and how understanding those signals can give you real, actionable power over your health. And I want to tell you clearly from the very beginning of this conversation, your body is not working against you. It is always trying to communicate with you. The question is whether you're listening. So let's listen together. The first warning sign I want to talk about is one that gets dismissed more than almost any other symptom in medicine: blurry vision. Not the kind that hits you when you first wake up and clears in 30 seconds. I mean the kind that comes and goes throughout the day, that shifts with no obvious explanation, that makes you think maybe you need a new glasses prescription when the real issue has nothing to do with your lenses at all. Here's the biology behind this, and it's genuinely fascinating once you understand it. The lens of your eye, that small, flexible, transparent structure sitting just behind your iris, is extraordinarily sensitive to the fluid environment around it. It relies on a careful balance of water and biochemical pressure to maintain its shape. And that shape is what determines how sharply you can focus on the world in front of you. When blood sugar rises, and especially when it rises and falls unpredictably throughout the day, it changes the osmotic balance inside the eye. Osmosis is simply the movement of water across a membrane to balance concentrations on either side. When glucose floods into the bloodstream after a meal, or spikes from stress hormones, or climbs through the night from insulin resistance, water gets pulled into the lens along with it. The lens swells, its shape changes, and the world goes slightly out of focus. Then, as blood sugar drops, the lens releases that fluid, shrinks back, and your vision shifts again. This is why people with uncontrolled blood sugar often notice that their vision is clearer first thing in the morning or after a period of not eating, and blurrier an hour or two after meals. It's not random. It's your body responding in real time to the chemistry circulating through your blood. What's particularly important here is that this mechanism is reversible in the early stages. I want you to hear that clearly. This isn't permanent damage we're talking about when we're in this early phase. This is a warning, a biological signal. The body saying very specifically, something in my metabolic environment is unstable, and I need attention. Now, a lot of people who experience this symptom do exactly what feels logical. They go to an optometrist, they get new glasses or contacts, and sometimes, yes, that helps in the short term. But here's what often happens. 3 months later, the prescription already feels slightly off again, and the real story, the metabolic story, never gets told. That's one of the quiet tragedies of this particular warning sign. It wears a disguise, it looks like an eye problem, but it's actually a blood sugar problem. The second warning sign is one that most people have never connected to diabetes at all. And when I explain the biology, I think you're going to find this genuinely surprising. It involves what happens to your night vision. Think about the last time you walked into a dimly lit room, a restaurant, a movie theater, a hallway in your home at night. Most people's eyes adjust within a few seconds to a minute. That adjustment is called dark adaptation, and it's powered by a very specific visual system inside your retina. The retina, for those who aren't familiar with it, is the thin, light-sensitive layer lining the back of your eye. It's essentially a direct extension of your brain made of neural tissue, and it is one of the most metabolically active tissues in the entire human body. Per unit of weight, the retina consumes more oxygen and more glucose than almost any other tissue you have. Now here's where this gets important. When blood sugar is chronically elevated, even at levels that don't yet qualify as full diabetes, what researchers call prediabetes, the delicate blood vessels supplying the retina begin to experience stress. Excess glucose triggers something called glycation, where sugar molecules essentially attach themselves to proteins and fats in the blood vessel walls. This makes those vessels stiffer. It makes them more prone to small inflammations. It impairs the smooth, continuous flow of nutrients and oxygen to the retinal cells that depend on them. The rod cells, the specific photoreceptors responsible for low light and night vision, are incredibly sensitive to any disruption in their blood supply. They are among the first retinal cells to show stress when vascular function begins to deteriorate, and one of the earliest, most measurable signs of this is a slower, less effective dark adaptation response, meaning your eyes take longer to adjust in low light, or they don't adjust as fully as they should. What's fascinating is that researchers studying early diabetic and prediabetic populations have found measurable changes in dark adaptation before any other traditional markers of diabetic eye disease appear, before microaneurysms, before hemorrhages, before any of the classic findings that an ophthalmologist would flag as diabetic. Retinopathy. The dark adaptation change comes first. This is why I find this particular sign so compelling. It's early, it's subtle, and almost nobody talks about it in the context of blood sugar. So if you've noticed that your night driving has become more challenging, if restaurant lighting that once felt comfortable now makes it harder to read the menu, if you take longer to see clearly when you move from a bright space to a darker one, those aren't just signs of age. They may be signs that your retinal vasculature is under metabolic stress, and that's a message worth taking seriously. I also want to take a moment here and address something directly. If you've been watching this and feeling a rising sense of concern, that's actually an appropriate response. Not because I want you to feel afraid, I don't. Fear is not useful. Knowledge is useful. But this is the kind of topic where gentle urgency matters, because blood sugar imbalance is one of those conditions where early action makes an enormous difference. The body has a remarkable capacity to recover and recalibrate when given the right support, but the window for easier intervention doesn't stay open forever. So let this information motivate you, not paralyze you. And if this kind of content, the deep science-based explanation of what's actually happening inside your body, resonates with you, this channel is dedicated entirely to that. Real biology, real mechanisms, real hope. So if you haven't already, consider subscribing. There's a lot more here that I think you'll find valuable. Now, the third warning sign. This is the one I find most scientifically profound, and it's also the one that carries the most urgency in terms of what it signals about where your blood sugar story is heading. It's called floaters, but not the occasional harmless kind that almost everyone experiences from time to time. I'm talking about a sudden increase in floaters, a noticeable change in the pattern or frequency of what you see drifting across your visual field, particularly in bright light or against a light-colored background. Maybe small dark specks, maybe thread-like shapes, maybe something that looks almost like a cobweb drifting slowly at the edge of your vision. Now, floaters exist on a spectrum. Many are benign. They're caused by tiny clumps of collagen fibers in the vitreous, the gel-like substance that fills the interior of the eyeball, casting small shadows on the retina. This can happen with age, with dehydration, with sudden changes in head position. In isolation, occasional floaters are usually nothing to be alarmed about. But here's what changes the picture dramatically. When blood sugar has been chronically elevated, the small blood vessels feeding the retina, called microvasculature, begin to weaken. Glucose, particularly at sustained high levels, damages the pericytes, the specialized support cells that wrap around those tiny vessels and help regulate their integrity and blood flow. As pericyte loss accumulates, the vessel walls become fragile. They can develop tiny bulges called microaneurysms, and eventually some of those microaneurysms can leak or rupture. When blood escapes into the vitreous chamber of the eye, it appears as floaters, dark, often mobile shapes that weren't there before. This is one of the earlier visual manifestations of a condition called diabetic retinopathy, one of the leading causes of preventable vision loss in adults worldwide. What I want to be very clear about is this: seeing floaters doesn't automatically mean you have diabetic retinopathy, but a sudden increase in floaters, especially in someone who has other risk factors for high blood sugar, fatigue after meals, increased thirst, frequent urination, family history of diabetes, belly fat accumulation, difficulty losing weight despite effort, that combination of signals is one your body is sending you for a reason. It's asking you to pay attention. And here's something that I think genuinely changes the way people understand this. Diabetic retinopathy doesn't usually hurt. The eye doesn't always give you obvious distress signals when vascular damage is beginning. Vision may not dramatically worsen in the early stages. This is one of the reasons why millions of people lose meaningful Vision to this condition every year, not because treatment doesn't exist, but because they didn't know to look for the early signs. They didn't know their eyes were already telling them a story. You now know to look. Let's take a step back for a moment and bring this all together in a broader biological picture, because I think this is where the real depth of understanding lies. Blood sugar dysregulation, whether we're talking about prediabetes or type 2 diabetes, is fundamentally a vascular disease as much as it is a metabolic disease. This is something that doesn't get said clearly enough. When glucose levels are chronically elevated, the damage that unfolds is happening in blood vessels throughout the body, the kidneys, the nerves in the hands and feet, the heart, the brain, and yes, the eyes. The eyes are simply where the damage often becomes visible first, because the retinal blood vessels are among the most delicate, most demanding, and most directly observable vasculature in the human body. An ophthalmologist can look into your eye and literally see your blood vessels. That's remarkable. No other part of the body offers that window. What researchers have discovered over the past decade is that retinal imaging is becoming one of the most promising tools in early metabolic disease detection. There are studies showing that patterns of change in retinal blood vessels can predict diabetes risk years before a blood test would flag anything abnormal. The eye, it turns out, is not just a window to the soul, it's a window to your vascular health, your metabolic health, and potentially your future risk for serious chronic disease. Now I want to shift gears, because I think you came here tonight not just for biology, but for something actionable, something that gives you a sense of agency over your own body, and that's exactly where I want to take this conversation next. If your body is showing you any of these signs, fluctuating vision, impaired night adaptation, a change in floaters, the most important first step is clear. See a doctor. Get a comprehensive dilated eye exam. Get your fasting blood glucose tested. Get your HbA1c checked, which is a marker that shows your average blood sugar over the previous 3 months. These are simple, available, low-cost tests that give you real information, real answers. Don't skip this step. But beyond the clinical tests, there are things happening in research right now that I find genuinely exciting, because they show just how responsive the body can be when you give it the right inputs. One area that's generating real scientific interest is the impact of specific dietary patterns on retinal blood flow and vascular integrity. Researchers studying populations that eat diets rich in certain polyphenol-containing foods, particularly foods with high concentrations of anthocyanins, which are the deep blue, red, and purple pigments found in berries, black beans, red cabbage, and cherries, have observed measurable improvements in retinal microvascular health. Anthocyanins appear to reduce oxidative stress in blood vessel walls, support the health of the parasite cells that are directly threatened by chronic high glucose, and reduce inflammatory signaling in retinal tissue. Bilberries in particular, which are a close relative of blueberries and are common in European research literature, have been studied specifically for their effects on visual function. While I want to be careful here, no food is a cure and no food reverses established retinal damage. The data suggesting that polyphenol-rich foods support vascular health in the eye is genuinely credible and worth paying attention to. Leafy green vegetables deserve a mention here too, because they're one of the most underappreciated foods in the context of eye and metabolic health together. Spinach, kale, Swiss chard, these are rich in lutein and zeaxanthin, carotenoids that concentrate specifically in the macula, the central part of the retina responsible for sharp, detailed vision. These compounds have antioxidant properties that appear to protect macular cells from oxidative damage, the same oxidative stress that's amplified by chronic high blood sugar. And separately, the nitrates found in leafy greens support nitric oxide production, which helps blood vessels dilate more effectively, improving blood flow throughout the microvascular system. There's also strong evidence connecting blood sugar control and omega-3 fatty acids. The photoreceptors in your retina, the rods and cones, have some of the highest concentrations of DHA, a long-chain omega-3 fatty acid of any tissue in the body. DHA is structurally critical to the membranes of those cells, and research has consistently shown that adequate omega-3 intake, particularly from fatty fish like salmon, sardines, and mackerel, is associated with better retinal function, reduced inflammatory signaling in retinal vasculature, and improved insulin sensitivity in the broader metabolic system. Insulin sensitivity, that phrase matters enormously here, because one of the core mechanisms driving blood sugar dysregulation in most people isn't that the body has stopped producing insulin. It's that the cells have become less responsive to it, a state called insulin resistance. The pancreas keeps making insulin, but the cells aren't listening as well. So glucose stays elevated in the blood longer than it should, and all the downstream consequences we've been talking about, the osmotic cleanse, swelling, the retinal vascular stress, the parasite damage, those are all consequences of that sustained elevation. What we know from research is that certain lifestyle factors powerfully improve insulin sensitivity, Regular physical movement, particularly after meals, even a 10 to 15-minute walk after eating, has been shown in multiple studies to meaningfully blunt the post-meal glucose spike, not because exercise burns a huge number of calories in that short window, but because muscle contractions during movement activate glucose transporters in muscle cells independently of insulin, pulling glucose out of the bloodstream through a pathway that bypasses the insulin resistance problem entirely. Sleep quality is another factor that most people dramatically underestimate in the context of blood sugar. Studies have shown that even a single night of poor sleep can measurably worsen insulin sensitivity the following day. Chronic sleep deprivation over weeks and months creates a sustained hormonal environment, elevated cortisol, elevated ghrelin, suppressed leptin that actively drives blood sugar dysregulation and metabolic dysfunction. If you're getting less than 7 hours of quality sleep regularly, that is a biological contributor to the very mechanisms we've been discussing tonight. And stress. Chronic psychological stress raises cortisol. Cortisol triggers glucose release from the liver. That glucose elevates blood sugar. If you're in a period of prolonged stress with no recovery, your blood sugar is being influenced by your nervous system every single day, regardless of what you eat. This is why the mind-body connection in metabolic health is not a wellness platitude, it's real physiology. I want to take a moment here and talk about something I think about often in the context of all of this, because when we look at these three eye signs together, the shifting blur, the struggle with darkness, the changing floaters, what we're really seeing is a body that has been patient. Quietly, diligently, it has been managing an increasingly difficult metabolic environment. It has been compensating, adapting, trying to hold the line. And then at some point, the signs begin to surface, not as failure, as communication. Your body is extraordinarily intelligent. It is always trying to preserve you. And when it produces these signs, it isn't punishing you. It isn't broken. It's asking for help. It's asking for understanding. What I find most hopeful in all of the research I've reviewed, and this is something I genuinely believe, is that the window for meaningful intervention is wider than most people think, and the tools available to us are more powerful than most people realize. Blood sugar dysregulation is not a sentence. It is a signal, and signals, when responded to with knowledge and intention, can be reversed, reduced, and transformed. People who are in prediabetic ranges have restored completely normal blood sugar through targeted lifestyle changes. People with early-stage metabolic dysfunction have watched their vascular health improve on imaging. People who were told they were heading toward diabetes have, through genuine dietary and lifestyle transformation, changed that trajectory entirely. This is not wishful thinking. This is documented. This is published research. This is what human biology is capable of when it receives the right environment. So what I want you to take away from tonight is this. Your eyes are telling you something. Whether you're experiencing the vision fluctuations we discussed, the changes in low light adaptation, or new or worsening floaters, please take those signs seriously. Not with panic, with clarity, with the kind of calm resolve that comes from understanding what's actually happening in your biology and knowing that you have more influence over that biology than you might have believed an hour ago. Schedule the exam, ask for the blood work, have the conversation with your doctor, and in parallel, begin making the small, sustainable shifts that science tells us make a genuine difference. More movement, particularly after meals, more color on your plate, particularly from polyphenol-rich and leafy green foods, more quality sleep. More active stress recovery, fewer processed foods that spike and crash your blood sugar in rapid cycles, more fatty fish, more fiber, more foods that support rather than strain your vascular and metabolic systems. These aren't dramatic interventions. They're not extreme or difficult or requiring superhuman discipline. They're biological inputs that your body is actually designed to respond to. And that response, when you give your body what it needs, can be genuinely remarkable. The eyes are where we started tonight, but the story is so much bigger than vision. It's about the whole ecosystem of your health, your heart, your brain, your energy, your longevity, your quality of life in 10, 20, 30 years from now. The decisions you make at the biological level today are writing that future, not locking it in. Writing it, and writing can always be revised. I'll leave you with one thought. The fact that you watched this far tonight, that you stayed with this conversation, that you took the time to understand what your body might be trying to tell you, that itself means something. That's not a small thing. Most people scroll past. Most people wait until something is undeniable before they pay attention. You didn't do that. And that kind of attentiveness, that willingness to look clearly at your own health without turning away, that is one of the most powerful things any person can bring to their own biology. Your body has been paying attention to you for your entire life. It's worth returning the favor. If this conversation meant something to you tonight, please share it with someone you care about. The people in your life who are struggling with fatigue, with vision changes, with weight that doesn't shift, with blood sugar concerns, they need this information too. And if you want more of this kind of deep, honest, science-grounded health exploration, this channel is here for exactly that. Subscribe, stay close, and keep asking the questions that matter. Take care of your eyes, take care of your vessels, take care of yourself. Good night.